Hi everyone, this video is meant to serve as a training tool to show future representatives and or staff what they might be missing when it comes to maintenance and cleaning of a typical saliva ejector valve in a dental unit. So this one, we were fortunate to have it loaned to us from a local office who switched over to using disposable valves. The feedback that we received was the office was getting limited suction power, and also we're having problems with the lever, which is this little piece right here, sticking when it was being used. So I'll walk you through a couple things that we discovered when we went into the office, and we were able to show the staff some of the things that might help future saliva ejectors so they don't have this issue. So in order to remove this, we were able to snip it. So we snipped it off the existing tubing that was in the office. The color of the tubing was brown. However, the original color was surf color. So tremendous amount of discoloration, which can happen when you spray the different chemicals or wipes on the surface, but the interior should be alarming to the staff as well. There is a tremendous amount of buildup inside there. The feedback that we received from the office was this particular room was being cleaned or flushed weekly. So a couple things that we would recommend: either flush each valve every patient and or disassemble these valves every patient and scrub them down. And the reason you will soon discover can have tremendous benefits on the performance of the instrument. So every saliva ejector on the market is connected via a tailpiece. So back here, they should have a slight swivel to them, just like a typical dental handpiece. To remove them, you simply pull them apart. Most dental offices who are not disassembling the saliva ejectors are going to have a very difficult time. This particular one, we tried to do that, and when we did, it was an extremely difficult pull, and when we pulled it off, this O-ring popped out. And this O-ring is tremendously discolored. It has no pliability or flexibility left to it. It should have been changed quite some time ago, and it was very evident that it was never taken off because of the stiffness and the lack of swivel that it provided. That O-ring would fit in the back of this little tailpiece, and hopefully you can see some of the discoloration inside that tailpiece that occurs if you do not flush these little tail pieces along with disassembling your valves. So to go onto the valve itself, there are a few parts here that you can show the different staffs that might help them gain performance on these instruments. Every little rubber cup should remove. Inside the rubber cup, you should see a clean surface, because this is the port that comes very close to a patient. If you look at this one, there's debris inside here, there's buildup, and it is brown. So my guess is weekly flushing was not sufficient. On the front end, where the cup connects, there is a little filter trap. And inside this filter trap, you should be able to pull it out. And when you pull it out, many offices say they flush these or clean these daily. This one has some buildup in it. Looks like it has some chunks that we probably can just, you see them right here, that were built up and left behind. Again, all these things will limit the performance of the suction valve. On the front end, if you take a look at the interior of this valve, if I simply take my Explorer and scrape around in here, you're probably going to see more chunks fall. And these are all things that if the office had backflow, which happens in the case of saliva ejectors, anything in this area, in the front cup, or in this filter trap can go back into the patient's mouth, which should be a definite concern. Another part that you can take off and show your staff or the office that you're going into are these little levers. They're either going to be in plastic or they're going to be in metal. This particular one is plastic, and on both sides you can see there is evidence of tremendous buildup of debris. It's almost black in color. And if you're simply wiping off the instruments, there's no way you can clean these components that are out of reach. Where those actually connect to are this little spindle inside here. All of these little spindles should be able to be removed with some pressure and some wiggling out of the little device. What I did is removed this spindle from the inside. The hole here is actually where the suction goes through. And just like we showed before, there is chunk after chunk of debris that we could pull out of this. And these are situations that we see all the time, because to take this apart is not fast, and unfortunately to clean it efficiently you would have to scrub this component. So there is a major chunk that is sitting inside here, almost like the size of a dirt ball, that if I just sit here and worked at it, you'll see all the debris that's built up down here. And this is one saliva ejector. If I were to take off these O-rings, they would snap right in half because they've never been lubricated and have never been cleaned. Going back to the actual valve component. So now you should be able to get a better image, and hopefully on the rear end here, if you take a look back here, the chunk is bigger than any of the ones that I've been able to get out so far. So there's a big piece that just kind of fell out. Backflow, if you read the studies, backflow is an area that 21% of the time it's proven that whatever is in that suction line or that valve could fall back into the patient's mouth through backflow if the patient closes their lips around the tip of the straw. And I don't know about any of you, but if I was a patient in this particular office and this was coming out of the valve, I can't even see through that now, it's so clogged, and this was coming out of the valve, I would have some serious red flags about the office I was about to visit. And just for your information who are viewing this, we see this in most of the offices we visit, because to clean this little valve, which patients do touch, is very, very difficult to do, time consuming, but it should be a vital component of infection control practices in every dental office. So for the users out there who want to get in and actually see what's going on in your office, you can do the same thing. You can take this apart. What is recommended per every manufacturer of a metal valve is to take these components and scrub them with a brush, physically run them through a reprocessing station, whether it's an autoclave or another type of device that is approved, put it back together, test it, put it back on the line. Every patient. There are certain facilities that do that every patient now. One of them is the VA medical centers. They physically take these apart and make sure none of this would ever happen. So hopefully this was of benefit to you. Thank you for watching. Have a great day.